Hello and welcome to today's episode of Dr. Welling's Health Show. Today we are going to see how to prepare yourself for maximum IVF success. Now I am Dr. Saurabh Welling and I help couples conceive naturally, especially those couples who would not like to go for artificial treatments like IVF or any other treatment including donor sperms and donor egg. But there are a lot of compulsions between the couples when they would like to go for IVF treatment. They would not like to try artificial treatment at all. And at those times, what you should do or you can do to improve your success rate, how to prepare yourself, that is what we'll be seeing in today's video. So, we'll be covering everything in 7 steps. Before we start in the step 1, you need to understand is how to process or what is the exact steps you are going to undergo in IVF treatment. Because you will be going through a lot of processes and steps as you go ahead in IVF. So what is the exact steps and what are the other steps outside at home you can take to maximize your success? So what are the steps usually in IVF? The first is ovarian stimulation, where hormonal medications are started for a female to increase the chances or increase the frequency of getting successful multiple eggs for extraction or retrieval. The next step is egg retrieval. Here there is a minor surgical procedure to collect mature eggs which are already developed due to your earlier hormonal injections. Then is the day when the doctor decides to go for fertilization. At that time, the eggs are combined with the sperms. Also, the sperms are extracted earlier. They are combined in lab to create something which is called as embryos. Then embryo transfer happens. In embryo transfer or embryo implantation also as it is called, those are placing your healthy embryos from the lab into a uterus of the lady. Then they wait for some time, the process which is called as embryo development, where to confirm whether the embryo is implanted very well inside the uterus, it becomes successful. They wait for 3 to 5 days for the embryo development in your uterus. And many times the failure is at this process because implantation is always a complicated procedure. And then if it goes on for next week or 2, that means your IVF is successful. The duration and emotional aspect of it has to be looked for because 4 to 6 weeks you have to give dedicatedly for this procedure per cycle. So you have frequent visits, multiple injections, multiple investigation steps, and your emotional strength and emotional resilience is needed because a lot of times you have to go through a slight pain of injections, the inconvenience of getting admitted to hospital, but finally if everything is successful, it's always good for that. Then let's see the medical preparation. So for the usual test for females which is done before you go for IVF treatment is AMH levels, is where they check your ovarian reserve. This shows your ovarian reserve, your egg balance, and many times if this is low, your doctor might suggest to you egg donor, which is the time where a lot of couples visit our clinics because our clinic has helped a lot of females with very low AMH to conceive naturally. Then they do various thyroid function tests. Thyroid health to be checked directly, which impacts the fertility. So if thyroid, that is TSH, thyroid stimulating hormone, is very high, you are suffering from something called as hypothyroidism, which prevents fertilization and even an embryo development. Then they will check your hormone panels, that is follicular stimulating hormone, FSH, LH, estrogen. They'll also check prolactin levels at various stages in your cycle. Then there is baseline ultrasound scans which is done for uterus and ovaries to check if everything is healthy there is no structural defect which can prevent implantation or successful pregnancy. And then they will be checking for various infections if you have. If you have HIV, hepatitis, any infection or disease which can be transferred to your baby, they will be checking for such infections. For men, it's very simple. They will check semen analysis for count, sperm motility, and sperm morphology. Now here, if there is problem with your sperm count or any of the other things, then they will go for hormonal test in detail to check why there is a count less. Again, if there is zero sperm count, lot of times the couple will be asked for either to go for biopsy or to go directly for donor sperms. These also cases, a lot of cases practically every week we get from all over the world at Welling Homeopathy for treatment of a condition called as azoospermia. Then you will be having consultation and history review, or detailed history review your doctor does from day one of trying to get pregnant. What has been the condition, how many times natural failure has happened, how many years you have been trying, what are the illnesses you have gone through from childhood, to understand what has been the problem with. They will try to address the health issues like thyroid imbalance, which I told you. They will try to correct the vitamin deficiencies. They will usually start a supplement of folic acid with you to make you more receptible for the embryo and for early days of pregnancy. Then they will be confirming with you all the medication protocols and timeline which will be you will be undergoing during the IVF treatment. And then there will be some pre-IVF treatment protocols which your doctor will give you for 1 or 2 weeks before the exact IVF procedure is supposed to be carried out. So this pre-IVF treatment is the one which we discussed earlier to get your eggs ready, multiple eggs to develop. So till now here you know what is the IVF process and what are the tests and medical preparation which goes through. Now here is the core what will be starting now: lifestyle, nutrition, mental and emotional readiness, financial, logistic planning, and building a support system. So in nutritional, the first is dietary recommendation. Try as much as green vegetables, leafy green vegetables, dense foods. Stop all burgers and ready food, fast food for the time you decide to go for IVF treatment till you are confirmed pregnant. During this time, stop eating all outside food. Try to eat dense, nutrition dense foods like leafy green vegetables. Have as much colorful vegetables, yellow, green, red. All will help you get antioxidants in your body. Have healthy fats. Have omega-3. You can have fatty fish for that, or food prepared in olive oil. Have avocados, have nuts. Have lot of healthy vegetarian source for omega-3 fatty acids. Go for proteins, go for lean protein. If you eat non-veg, go for chicken, fish. If you are vegetarian, go for legumes. If you eat eggs, try to eat 1 or 2 eggs every day to have a good protein baseline with you when you go for pregnancy. This is very important. 1 or 2 eggs every day, we have seen, gives you good vitamins, good proteins, good calcium to carry forward your pregnancy. Have whole grains. Don't stop yourself from eating home food with good food, home grains during your preparation for pregnancy. And then you go for folate rich fruits, fruit and vegetables. As I said, go for leafy greens, go for lentils, and go for oranges, mosambis, all the citrus fruits which will give you good folate in that. Go for guavas which give you good vitamin C. It reduces your oxidation in your body. It reduces inflammation in your body, which helps diseases like endometriosis or PCOS if you are suffering from them. Usually these are the supplements which your doctor anyway will suggest to you, but if they are not suggesting, you can ask them before starting this, but these are the very much required. Lot of these supplements we advise in our natural homeopathic treatment, which will help you conceive naturally. Now, these are not all the ones which we tell all our patients. That's why I told you, depending on your reports, depending on your health, this will be required. So folic acid in 99% of the females, it's required. It should be taken 400 mcg daily. Then you have vitamin D, because many people in India and abroad are deficit in vitamin D. So vitamin D tablets or capsules are started. Then there is CoQ10, which improves egg quality. Then there is omega-3 fatty acids, which we already discussed. And for men, there is zinc, selenium and vitamin C can support sperm health. Usually try to get a single multivitamin which has zinc, selenium and vitamin C in good quantities. All these supplements have to be started 3 months before IVF or before you are trying to conceive. The next are the foods which you need to avoid. My internet connection has, yes. So the food to avoid, limit your caffeine to less than 200 milligram daily. That's, try to keep it to 1 cup of coffee in the morning or 1 cup of coffee in the afternoon. Eliminate smoking completely till you don't deliver a baby. So because it damages the egg quality and reduces your IVF success rate by up to 50%. Now you have to understand here that IVF success rate globally is said to be around 18 to 22% per cycle. So if you are going to reduce it more by 50% by opting to smoke, then your success rate goes down drastically. Avoid alcohol as much as possible, because even moderate drinking has impacted fertility, has caused miscarriages in patients, especially those who go for IVF or artificial treatments. Reduce processed foods, trans fats, they promote inflammation. Again, burgers, pizzas, complete no till you don't deliver a baby. But at least compulsory till you don't get a positive pregnancy test result, stop them. Then probably you can eat once in a while till you don't deliver a baby. And the next is hydration that matters. So drink at least 8 glasses of water daily to support circulation and your egg health. This is what we are talking now currently here, remember, is your time from the time you decide to go for IVF treatment until you don't get confirmed pregnancy report. Because after that, lot of new recommendations come, some may go down. So these are only till your pregnancy test comes positive. Next are emotional and mental readiness. Number 1, practice stress management techniques. Consider yoga, meditation, deep breathing exercises. Studies show that stress reduction can positively impact IVF outcome. Now already you are stressed out due to not able to conceive naturally. Then there are a lot of times multiple IVF failures which happens. So every cycle gives you more stress overload. So all this creates a lot of rebounds effect on your body. That is the reason why we always tell that before you go for IVF, try all your natural options including homeopathic treatment. If you would like to go for any yoga or conception, try my video Yoga for Infertility, which is there in my channel. Those yoga postures are proven to affect or help women and men get pregnant fast. Then next one is consider therapy or counseling. Speak with a therapist who specializes in infertility, can provide valuable input. Here what we see in our clinic is, other than treatment, when we have to counsel a probable mother or prospective mother, it always helps us get results faster. So coincidentally, a homeopathic doctor is also a good counselor. So it's combined into one. But when you go for IVF treatment, your doctor may not be the best counselor who will be doing IVF treatment. So either go for a counselor or talk to a good friend who has gone through IVF treatment. Number 3 is journal your thoughts and feelings. Writing can incredibly help you. It's a therapeutic. It helps you release your thoughts and helps you process the emotional ups and downs which comes with IVF treatment. Then communicate openly with your partner. So if your wife, you talk to your husband should talk to the wife continuously, relate your thoughts, tell out your stress factors, and empty your mind in front of your partner. Because IVF affects both of you, remember that. Set aside time to discuss your fears, expectations, and how you will support each other. Remember, you are both a team who are looking for a healthy baby in few months' time. And of course, set realistic expectations. Because IVF, natural pregnancies, homeopathic treatment, or any treatment in the world doesn't guarantee pregnancy in the first try. Success rates vary based on the age, diagnosis, and lot of other factors, including the stress which a couple is going through. So understanding this upfront helps manage disappointment later on. Then the most important factor which we will be seeing is financial and logistic planning. So understand the full cost. Ask your clinic for a detailed breakdown including your medications, procedure, lab tests, potential additional cost like embryo freezing or genetic testing. Now why we tell this? Because a lot of times a patient comes to us for consultation where they quote that IVF treatment has been told to them for around 75 to 80,000. Now the medication costs itself which is required for a artificial treatment could go to around 1 lakh. So whatever treatment cost has been told to you is usually the doctor's fees only. Additionally, there will be medicine cost, lab tests, procedure, the operation theatre cost. So always during the first visit itself, ask them the total or full cost that you will be paying, including all the additional cost for embryo freezing or genetic testing or whatever they have to tell you. Ask them the full cost for one cycle. Check your insurance. In India, IVF treatment is not covered under insurance, but in some countries, it is covered. Some policies cover IVF partially or fully. So review your policy carefully and speak with your insurance representatives. Don't assume coverage, verify it, be sure so that financial planning can be done by you very well. Next is exploring financial options. Many clinics offer payment options. And there are specialized fertility financing companies also who can give you regular EMIs to cope up with the costs. Always remember that, or even your IVF doctor will tell you that usually you have to be ready for around 2 to 3 IVF cycles even before you start planning for IVF. Because of the success rate which I already told you, many times your second or third cycle may be successful. So plan financially for first 2 or 3 cycles and then enter the procedure from day 1. And always budget for medication, which I already told you. Now this medication cost could be for a simple cycle go up to 1 lakh rupees or more, depending on the setup, depending on the hospital, and depending on from where you are buying. So shop around, go to various pharmacy stores, go for discounted stores, go for generic medications if available and if possible for your doctor to get down the cost of the total IVF for you. And the last is logistic planning here. So create a medication tracking system, set phone alarms for injection times. Organization prevents, these all organization prevents missed doses which can jeopardize or trouble your cycle. Plan for time off from your work, especially if you're working in stressful jobs which doesn't get you regular food, regular rest, regular sleep. Plan for all these things, especially around egg retrieval and transfer. You will need lot of rest, mental relaxation, reduce stress during these critical periods, and arrange transportation. You cannot drive after egg transplantation or implantation, after egg retrieval due to your under sedation. So line up help in advance. As I already mentioned, you as a couple should be always together with your partner. So partner can plan for all these things, but plan all these things in advance, because the earlier step of egg retrieval, you will be under sedation, and also after implantation. So both during these times, you plan your travel and transport very much in advance. Now, having Facebook and Instagram, there are a lot of IVF support groups, whether in person or online. Connecting with them will help you resolve a lot of other problems which you might not have understood when you decided to go for IVF treatment. There are couples who have successfully undergone one IVF cycle. There are a lot of couples who have failed IVF cycles who are in this support group. Will help you navigate through all the problems. There will be a lot of organizations which can help resolve all your queries which your doctor is not able to resolve them. Choose who you tell carefully. You don't owe anyone an explanation. So in your family members, in your friends, you don't have to announce you are going through this. Share your journey with people who will genuinely support you, not those who will offer you unsolicited advice or invasive questions or give you options once you make a decision. Why I'm telling you this is, once you have made a decision that you're going to go for IVF treatment, there will be a lot of your friends would suggest to you some other treatment. Even they will suggest to you our homeopathic treatment. But once you make a decision mentally that you would like to go for IVF treatment, then don't change it till you get your success, or at least your first cycle ends. Educate your support people. So your in-laws are there, your parents are there, your firstborn kid probably will be there. Give your close friends and family resources about IVF so they better understand what you will be going through, what you may need during those times or days. Sometimes people want to help but don't know how to help you. That happens with your parents, with your in-laws, even with the firstborn kid. He would like to help but doesn't know how to help. So you tell them specific guidelines to put reminders for doses or for injections or for any other medications you have to take. Once you come after implantation, what you would like them to do. And you also openly accept help. When someone offers to bring you meals, drive you to appointment, or just listen to you, say yes. You don't have to be strong all the time, and many times you would need another person to just listen to you or to help you. So don't just try to be egoistic and be very strong that you will manage everything. Take all the help you require during that time, because the goal should be only one thing here: getting pregnant. And if possible, find a fertility buddy from the forums which you will be joining, from the people in the company. Somewhere you will get a buddy who is going through the same procedure, same process during the same time. They may be going through IVF, or a trusted friend who has gone through IVF, who can text, you can talk to them late at night, because a lot of emotional times go through during your egg retrieval, after your egg retrieval, and just before the implantation is going to happen. You're going to go through a lot of mental turmoil, lot of stress, lot of anxiety, and you need to expose them or remove them from your mind. So you require someone, a fertility buddy, who has gone through all those emotions themselves. So again, just to quickly go through the checklist: all pre-IVF tests complete and results reviewed by your doctor, medications ordered and organized with clear schedule for administration, all the vitamins at least started at least 1 month prior, though I would suggest 3 months, but if you're in a hurry, there is no time, at least 1 month is good. Lifestyle modification in place: healthy diet, no smoking, limit alcohol. Support system is established, people close to you know what are your timelines and how to help you if required. Take the time off from work, arrange your replacements there, your key appointments, everything, plan it up. Plan financial planning completely, cost understood till the last rupee or cent or dollar. depending from where you're watching my video. Plan till the last moment. Mental health resources are identified. So who are the therapists, who are support group, coping strategies in case of the retrievals or lot of emotions, lot of anxiety, whom you're going to talk to. Your partner is prepared and you have discussed emotional support strategies together. So don't do this alone. Get your partner involved at every step. You see that he is prepared and you have discussed all the emotional support with him. And question your doctor, more importantly, about everything you're going to go through. Write down all the questions you would like to ask your doctor and never go to an appointment without your list or your questions. He will answer you most of your questions if you have properly noted them and asked them to the point. Hope this video helps you. And the final step is, remember, in any case, there are more options. Many couples need 2 to 3 IVF cycles to achieve pregnancy. This is completely normal and don't reflect on your failures. Success rate improves, your subsequent attempts, will improve with your subsequent attempts. So your second cycle, third cycle will be always more successful as your medical team learns to work best for your unique situation. And if IVF doesn't lead to a pregnancy after multiple cycles, there are other paths which exist, including our homeopathy assisted reproduction therapy. We offer both treatments to help you conceive naturally, where you would like to skip IVF totally, or if you have decided surely to go for IVF treatment for natural conception, we have a 3-month program and homeopathic treatment which we called as pre-IVF success treatment to help increase your chances of conception and a pregnancy in your IVF treatment. So remember, finally, this journey will test your patience and your resilience, but you are stronger than you know. Take it one step and one day at a time. Lean on your support system and remember that seeking help to build your family takes tremendous courage. If you require any help from me or from Welling Homeopathy Clinic to help you get pregnant naturally, or through IVF treatment, where we can only help you in pre-IVF treatment to make you ready, contact the number on the screen and we would be happy to help you. Bye, take care and all the best.